The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic. We've had him on the program before, Dr. Gasser. Dr. Gasser, welcome to the program.
Welcome back, I
should say.
It's great to be here. Thank you.
Now, before we get into today's topic, because people know you as Arizona's first choice for dental implants. That's about 90% of your focus? I mean, that's mostly what you do?
Absolutely. I first started working with dental implants 25 years ago. It's hard to believe.
Really? Okay.
25 years ago. But service in the Valley of the Sun for 18 years and have been focused in implants, which is a major commitment. It's a commitment of time, energy, and money to become focused on dental implants. 90% of what we do in today's practice is dental implant oriented.
You love it, though. You say it's the best part of
dentistry. It's so much fun because the effect that you have on people, the effect that you have that changes their lives in a way that's hard to describe sometimes. And I'm going to show you some examples later on. But that's the fun part, and it's a challenging, growing field that's always changing. The technology, things about it are just wonderful.
I had a dentist, and I told you, and he said, Randy, once I got into implant dentistry, it was addictive.
Yes. Yeah.
I mean, do you feel that way too?
I do. What's addictive is the response that you get from patients. We've been reviewing perhaps dozens and dozens of testimonials that we've reviewed from our patients over the years. And there's a theme in each one of them, and one of the things that they always talk about are the outcomes and how it has changed their life personally, professionally, how it's affected their family and every part of their life. And that's really the fun part. That's the addictive part, the fact that we can go to work and make a difference in your life today. And that makes
When it's all done, what's the common theme there? What do they say? What are they thankful about? What do they like?
They're really thankful, first of all, the function they have, the ability to simply enjoy the simple pleasures of life, to eat well, to be comfortable, to smile more. They're more confident, Randy. They're more successful in their business. Many of my clients are professionals. They're business people that are on the front lines of society on a regular basis. And so they bring more energy. You can see it in their photos. You can see it in their testimonials and their witness to us at how it has changed their lives completely.
So is your take is the fact that they don't like their smile, it may be holding them back?
It's definitely the case.
Or they're ashamed of their smile.
And many of these people have not liked their smile for decades. And I'm trying to give them permission to change the smile and the way they feel about themselves, because there are thousands and thousands of people that have been through the same experience, and having gone through this process, having gone through this treatment, has changed their lives for the better, and that is the addictive part of it.
Okay, so back to the original question. I mean, who is your typical patient? What type of patients do you see?
We see a wide range. We see anything from teens all the way up to 90 years old.
90?
And beyond, actually.
Okay.
You'd be amazed. A wide range of people. Probably our most typical patient that really has become most fulfilling for us are those persons in the middle-age years that have had difficulties with their teeth for a long, long time, and for various reasons, good reasons a lot of times, they've not been able to address their mouth and their health, competing priorities, and they finally kind of back up against the wall situation. They're in a transition, and those folks are so much fun to serve because we can do so much for them.
Is it because they just don't like going to the dentist? I mean, people still, do you hear that? I don't like going to the dentist, doctor.
Yes.
I mean, how do they say it? What do they say?
That's exactly what they say. In fact,
Really?
sometimes they're even more blunt. They'll say, I hate the dentist. And
they say no offense? I mean,
no offense, unfortunately.
That's funny.
But they will say that. In fact, a recent study done not long ago indicated the number one reason that people avoided going to the dentist was the fear of needles. The fear of needles, that was the number one thing. Now, I have to tell you, many, many years ago, a mentor of mine that was a very respected dentist in those days taught me a technique for giving virtually painless injections. And after 20 years of practice, I have to tell you, Randy, in fact, we try it sometime if you want me to prove it, I give excellent, painless injections. Every day in our office, somebody makes that comment. They're just amazed. They didn't feel
What do they say?
They'll say, are you done?
Now, we were talking, 3 years ago, was the last time I interviewed you, and you said a lot has changed. I mean,
even in 3
how
years.
so? How so?
Well, specifically, there's new technology for taking better images prior to the procedure. It's called an iCat. It's 3D cone beam technology.
In your office?
In the office. So they don't have to go anywhere else, which, of course, the first benefit is it saves time. It makes our procedures quicker, and maybe even more importantly, safer and more predictable. We know exactly what we're doing, what we have to work with. It takes away the guesswork.
When I hear things like nowadays in the right candidate, that it could be almost a bloodless procedure, placing of the implant.
Yes.
Is that right?
It's amazingly
And is that because of the imaging?
That's part of it. It's definitely made it much more safe, much more clean, much more precise. I call it a soft surgical procedure because everything's very clean, very well planned, and very, very predictable. And that's what some of this new technology has brought us.
Okay, the implants, have they gotten better in the last 3 years?
Always changes, amazing changes, not only in their design, but you know what? I can summarize it by saying that when it comes to the technology, the implants, what it has done, it has made things faster. We can get done quicker than we ever could with better results and more predictability. Those are the three benefits that technology has offered us.
Now, why is it that anticipating this interview, I ask around, that what used to take, I guess a year or 9 months, and some guys are still doing it, now can be done in one visit? Is that true? Is that right?
It is true. It is true. Actually, what you're referring to is something that's been used at least 20 years, maybe even longer, and it's called immediate loading. Randy, that's where you put the implant in, or implants, and you actually put the teeth right on them the very same day. That can be done.
Do you do that?
We do that. We do that frequently. But that can be done in certain cases. So we tailor every case according to the person's own situation.
So when I hear teeth in a day,
yes,
that's true.
It is definitely
with the right candidate.
With the right candidate. There's a saying that an idea can be a dangerous thing if it's the only idea that you have. We want to make sure that we apply the right techniques and the right parameters to each case, each individual. And everybody's very different. After doing this for 18 years now, there's so many variables. Everybody's goals are different. We make sure that we do the thing that's best for the patient.
Okay. Now, you brought some photos, and for people just tuning in, we're talking about what you need to know if you're considering dental implants. I want to talk about the categories of patients. I want you to take me through the process. And before we get into those photos, and these photos are dramatic, by the way.
Yes,
I mean, I've never seen mouths like this before.
Yeah. And there's a lot of people in that situation, Randy.
Without exaggerating. And I think if people are squeamish, some of these they may not want to look at. But the after is phenomenal.
It makes it work.
So the categories of patients you see that come in for dental implants, what are they?
Well, we have patients that have just one tooth missing, and we have patients that have several, or people that have no teeth at all. The most common patient, though, that we're seeing are people that have teeth, but they're in trouble. They're having problems. They're either going to lose all of them or a lot of them.
That means their general dentist may have said, hey, or have said that your teeth have to go.
Right, and they're confronted possibly with having to wear dentures or partials, removable devices that are very uncomfortable and very unpleasant to tolerate, especially if you're in your 40s, 50s. We're saying that the new 80s is the 70s, and these people are living vibrant, healthy lives.
They're working
professionals.
On it, right?
They are. And so what we see is a wide group of people, but people that range from just one tooth missing all the way to none, or people confronted with having to lose all their teeth.
Now, would you say that there are thousands and thousands of people in Arizona that are wearing dentures, for example?
Yes, indeed.
That don't have to be.
Yes, and don't want to. Many of them don't want to, and I want to give them permission to not have to. There are alternatives, even if a patient just uses a couple implants, Randy, to snap their denture in place. The difference is dramatic, all the way up to being able to put enough implants in that they don't have to have a denture at all. Changes their lives, changes the way they see themselves and the way the world sees them, Randy.
What about people, and I'm anticipating this interview, that their gums are bad. They're loose, and they say, dental implants probably won't work for me.
Randy, a lot of my patients will come in the office and assume because they have that problem that they cannot have implants. Actually, if the teeth can be saved, we want to help them do that, and there's ways to do that. But when that's not possible, then when those teeth are removed, so is the infection, Randy, and that infection is critical because it has an effect on their medical health. It's been connected to heart disease,
so the gums
strokes.
Get better.
It gets better by removing those teeth. You're removing the source of that infection, and then the implants can restore the teeth without infection, which is very important to their health.
Now IV sedation is new for you.
Yes, that's another big issue. Yes.
How has that changed things for you?
Tremendously, because as I mentioned earlier, the number one thing that people tell us after they've had the care done in their testimonials is they usually start by talking about the fear that prevented them from doing anything. And IV sedation is wonderful for that. It reduces that anxiety, that fear of going through the procedure.
Why is it better than just an oral?
It can be. It depends on the case. We can offer the oral conscious sedation. We would call it the happy pill. That works beautifully sometimes, Randy. Sometimes that's all a person needs. Sometimes we need more control and we need more security, and that's where IV sedation comes in. It's very, very safe. Randy, did you know that 75% of all medical emergencies in the dental office occur because of stress and anxiety? And IV sedation eliminates that, so it's not only just more comfortable for the person to experience it, but it's safer for them, safer medically.
So they don't remember probably
very, very little, in fact, yes. And oftentimes the very first thing they'll say, is it over? What did you do?
Really?
Absolutely, which is just a wonderful experience because then they're more comfortable about the entire experience. As I mentioned before, when we talk to our patients afterwards, they're thrilled with that experience. IV sedation just removes one more barrier for patients so that they can come have this done and not have to be worried about the fear. And you know, the other tremendous benefit, people are very busy in today's world, in the economy that we're in. They're working very hard. This makes our appointments more productive, more efficient. We can get a whole lot more done when they wake up. So much is behind them, and they're very thrilled about the efficiency. Again, implant systems now, implant treatment is quicker and faster than it ever was before, Randy.
So the age range is up to 90 years old?
Up to 90. We've actually done implants on a 92-year-old patient.
Now, why would they want to do that, though, at 92?
That's a very good question because many of my senior patients start the conversation with that. Why would I want to? I'm too old. And the answer is, simply put, it's a quality of life investment.
They can eat.
Absolutely, and smile and enjoy their life. There may be restrictions when you're 92 years old in what you might be able to do, but to converse, to go out in society, to have a meal, to be confident, those are things that people at that age are more than willing to invest in.
How soon can they eat after the procedure, ideally?
Almost immediately, almost immediately. In fact, there was a recent story of a fellow came in, he's a business owner. He had a complete case of implants done, went through the process, and he gave us his feedback afterwards. And he wrote it down for us, and it was very brief, testimonial, Randy. What really struck me, though, was that he advised us to tell patients that whenever they go out for their first bite, as he put it, to perhaps make sure they're in a private setting or with somebody that they're close to. And you want to know why?
Why is that?
Because he said it was a very emotional event. And you
Really?
might not want to have and show that emotion. It was so powerful for him. And this is a man's man that I'm telling you about, that's conveying just how powerful that was for him, so that he wanted others to know what to expect, so they might not be a little embarrassed because of tears or something showing in their face.
Interesting. Now, you brought a lot of photos, and you say you're changing people's lives.
Yes, yes.
You believe that? I mean, they tell you that.
I truly do. They tell us that. And I'd like to show you exactly some examples and tell their stories. These are personal stories.
Okay, let's take a look.
This young lady had some tremendous dental problems, as
Wow.
you can see here. A very bad case of infection. Imagine, Randy, trying to eat. The teeth were painful, sensitive to temperatures. Not to mention the fact, when I first met this lady, she was always staring at my feet when she was talking. She had her head down. And I thought perhaps there was something wrong with my shoes. And I looked down at the ground, and the reason that she was doing that, she's kind of covering her mouth. She didn't want the world to see her smile, or lack of her smile.
So she probably didn't smile at all.
And she worked in the front lines of society. She was at a bank as a teller, so it was very difficult for her. And the difference before and after in her personality is hard to describe. If you can look at these after photos here, you can see the difference in her. Imagine her smile now. Imagine her confidence level. Imagine her comfort, Randy. She can now eat in comfort without discomfort and pain. That's a life changer, and there are many, many people out there, thousands, just like her, Randy.
Really, like this?
Like that. She made an investment in herself, not just herself, but her career. Who would you hire, Randy? You talk about the difference between these two people.
Well, side by side, yeah.
There's no question about it.
She looks healthier.
Healthier, happier, more professional, more intelligent.
Good point, good point.
It made a difference in her life. That's the addictive part, again, of
so
implant
tough economy.
dentistry. tough economy, invest in yourself.
Really? Okay.
Invest in yourself, and also remember to make decisions, financial decisions, on your priorities, not your pressures. So in a tough economy, make investments in yourself. And we try to understand that it is a tough economy, so we offer payment plans that are flexible. We help people obtain the investment that they need.
So what does she have, by the way? So these teeth had to go.
Yes, they had to go.
So you gave her what?
And we gave her what we call snap-in dentures. So we put in enough implants, Randy, to hold a denture in place, and they snap in beautifully.
How many, for example?
Typically 4 on top and 4 on bottom, and that holds the denture in firmly. And so it's a life changer for her. She can speak without things moving around. She's confident, she's comfortable. The roof of her mouth is open so that she can taste better and it feels like she has more room. Snap-in dentures are one of the options that we use frequently.
And when they come back and it's all done.
Yes.
As far as self-esteem, I mean, this has to have an impact there.
A complete implant. You really can't recognize they're different people. They're very different people. She was no longer looking at my shoes. She had color in her eyes. She had vibrancy that she didn't have before.
Tell me this, when they see it for the first time, and I've had cosmetic dentists say, it's emotional when they see their teeth for the first time. I mean, this woman, because this is pretty bad.
It is bad.
When she sees it for the first time, though, the after?
You know what? You would think that there'd be this powerful response, sometimes overwhelming would be the word that I would use.
Oh, really?
As they feel overwhelmed, they're so wowed by it. And then when they get home, the response from the public is so powerful that it just changes and transforms them. And I want to tell you, Randy, that there are a lot of people in her condition like that. Many that have...
What kept her from doing it?
Good
Fear
reasons.
of the dentist?
Fear, competing priorities, other things that they had to do. We want people to know it's okay to be in that situation. There's a Chinese proverb that says, Randy, what's the best time to plant a tree 20 years ago? And what's the second best time is now.
So do something about it.
Do something now.
But you're a dentist, and I say this respectfully. Of course you think the smile is important.
But I have to admit that 95% of our body is covered by clothing, Randy, 95%. 5%, our mouth is right out there. It's out there for everybody to see. It's not covered. Our flaws are evident. And that's why I think the mouth is called the psychosocial center of the body. It's critically important to how you feel about yourself and how you interact.
Good point.
Yeah.
All right. Okay, so you have others, and we're going to take a break after a few more.
Sure. I want to show you a common person that we see. It's a professional, a male professional, owns his business, runs his business, doing a lot of work with the public, and upset with the fact that he had an upper denture that he just hated, Randy, lacked confidence, uncomfortable, loose when he ate, and then he was faced with the fact that his lower teeth were about to be lost. And he knew the thing that most people know, and that is that lower dentures are very difficult to get used to, very difficult. Many people, approximately half of them, don't wear them. They become dental cripples. This is a business owner.
Really?
This is out in the public. So he committed himself to investing in his mind, in the way he said it. He was investing in his business, and he didn't smile. He didn't smile at all. You can see it in his face. He just didn't have any energy, didn't smile. The difference, Randy, in before and after, I'll just let you describe it.
That picture almost makes you laugh, but he puts you in a good mood now.
How much better is his business? And again, that's what he said. This was an investment in his business, but it changed him personally as well. The color in his face is hard to deny. He was fearful, he was concerned, and he did not want anything removable. So we made an implant case that does not come out. Feels like real teeth, looks like real teeth, and smiles like real teeth. Look at the difference. He had discomfort every time he ate, Randy. Imagine every time you take a drink of coffee, maybe a Starbucks, it hurts. Every time you have a yogurt at Yogurtology or somewhere like that, it hurts. This was a guy that was in pain every day. The difference in his life not only is visible and cosmetic, which it is tremendously, but it's just comfortable. And the psychology of tooth loss no longer affected him. He regained himself.
Now these don't look like dentures, by the way.
They're not.
So you're involved. I mean, this is like a cosmetic dental implant. I mean, do you call it cosmetic?
Oh, absolutely.
Okay.
The implants are a very cosmetic procedure, although they're need-driven, Randy. They're something that people need to function with, to be comfortable, and to be healthy. The cosmetic part is sort of an extra bonus, and it changes their lives because it looks so good and natural and feels so much better. Okay.
We have time for a couple more before the break.
Wonderful. I'd love to show you this picture here of this lady who for 50 years never had the smile that she wanted. So she dreamed of having a beautiful smile.
She said that to you?
She dreamed of it for 50 years, and she finally reached the point where she wanted to do something about it. And so we talked to her about her options, and she chose to have fixed lower teeth and an upper snap-in denture.
So those teeth were what? Those had to go?
Those had to go. And she was afraid of the lower in particular, and she just never had to smile. She said that people felt like she wasn't very personable. They really didn't know her because she was very reserved, looked very serious, but afterwards she cannot stop smiling, in her words.
Very nice.
She finally achieved a 50-year dream. Now, how important do you think that was to her? Yeah. How do you believe that that changed her life? I mean, she's so much more vivacious and
chewing,
outgoing.
eating, right away.
Comfort of it right away. And that was the other point that many of our patients made, is immediately they would go out and test run their new implant teeth, and the difference was dramatic and sometimes emotional.
Now, you've been on TV for a while. A lot of these people see you on television.
Yes, they have.
And what surprises me is you say they didn't know it was possible for them.
They didn't.
Is that right? I mean, did they tell you that?
It's very true. A lot of them make false assumptions about what's possible and assume that they're not candidates. Maybe they're not candidates because they're too old, or because they have medical problems, because they have gum infection, or because their case is too bad. And that's really why we invite people to come visit us and share with us their story, because there are thousands of people that make assumptions that aren't true. There are many, many things that we can do for these people to change their lives.
I met you when I met you 3 years ago. My mother and she was 71 or 2 back then. So 3 years later, and she still doesn't believe. She thinks she's too old for dental implants.
Yeah,
and
I hear that frequently.
Fairly healthy person.
Yeah, ironically, the science indicates that there's no contraindication, no reason a person cannot have implants because of age.
So no more dentures. I mean, is that
Absolutely.
Is that the future?
Oh, I believe that's completely the future. I think that we'll look back on dentures as a fairly primitive, maybe even barbaric solution for people that don't have teeth. Implants are already mainstream, Randy. This is standard of care now.
Sounds painful, though.
I know it sounds that way. That's one of the most surprising things, and especially in today's environment with things like pain management control systems, IV sedation, post-operative pain management. We actually are calling pain control rating the 5th vital sign, because we want to make sure there's so many options for them to make sure they're very comfortable. It's startling, the feedback that we get from patients.
Are there those people that after you do the implant surgery that they just go home with Advil?
Absolutely.
And
that's the typical case.
Really?
Very, very typical, that the day after, we're always following our patients. I call them myself the night of the procedure. Our staff members will call them the next day. We check on them frequently, and almost always, 9 out of 10 times, Randy, they may be taking an Advil, maybe taking Tylenol. I assure you, that's it. It's remarkable if you follow the process correctly.
Okay, we're going to take a quick break. We come back, more about the process, more before and afters. We're discussing dental implants today with Arizona's first choice for dental implants, Dr. Gasser. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic. In fact, he's known as Arizona's first choice for dental implants, Dr. Gasser. Now, I know you have a lot of photos, and we're talking about denture wearers or people that have been told your teeth have to go. So they're faced with dentures, dental implants, and you have photos. So let's kind of rush through these for the sake of time.
That's this fellow right here. He was faced with losing all of his teeth and had great fear of wearing. And you can see the infection by your response. That's unhealthy for his heart. It's unhealthy for his body. And he just didn't smile. He didn't speak. No, he looked very gruff and rather cold, if you will.
You were scared of him.
He was a tough guy. He was a kind of what we might call a biker guy.
All right.
So he was a tough guy. But inside, he was hurting because he knew that his teeth were on the brink of coming out. He knew he had terrible infection. He also had a tremendous fear, Randy, of having removable teeth. He had a terrible gag reflex. He couldn't wear anything in the roof of his mouth whatsoever or on the bottom. And he really wanted a solution that felt like real teeth. He wanted fixed implant teeth, Randy, that didn't come in or out, something that he could be comfortable with and secure with. And that's what he received. And you can see the difference.
Very nice. Well, it's a huge difference.
It's a huge difference. He no longer has the infection. He has comfort. But also those teeth don't come out, Randy. They stay put. He just brushes them, flosses them, cleans them like regular teeth.
And so really you floss floss them too?
Yeah, we actually show people how to take care of them. It is wonderful that implants don't get cavities. They don't feel tooth pain. There are some benefits to them that natural teeth can't even offer, but there's certainly, it's important to maintain them and keep them clean, and we help patients with that and know exactly what to do.
You know, one of the things I learned from you, you know, we scheduled this interview was, you know, because I have my teeth. Right. So you say that it's more than dental implants, Randy. These are people that are kissing. These are people that have bad breath problems. These are people that can't eat and chew, and all that. And all that. It's given back to them.
It is. When we speak to these people after they've had the care done, when they give us their testimonials, they always finish the testimonial with the outcome, how it has changed their life, what it has done for them personally. Their ability to eat comfortably is certainly enjoyable, but their personality, their happiness level, their smile comes back to them.
And 2 implants for denture wear?
That can make a difference. Even that can make a big difference for people. A lower denture in particular, it moves 1.5 inches every time somebody moves.
Could that eliminate the glue, by the way, or the adhesive?
Yes, it can. Yes, it can. And it can make a world of difference. Have you ever tasted that adhesive? It's terrible.
No. I had it in my hands, by the way. You know, you can't get it off your hands.
It's terrible. It's messy. Everybody that has to use it complains about it. Even 2 implants that'll hold that denture in place can make a big difference to that person.
It surprised me. If thousands and thousands in Arizona have dentures,
right,
and 2 implants could, you know, dramatically make a big difference, why aren't they all doing it? Is it just, I think they don't believe it, they don't know, they think it's too much money? What is it?
All of those things, and that's why we try to make it easy for people to learn more about dental implants. That's why your show's so important. It helps people to know these things so that they can change their lives. They make assumptions. People that wear dentures often don't go to the dentist, but about every 5 or 10 years, if then.
Interesting. So nobody's telling them to do it?
Nobody's telling them to do it. They're not going to the dentist because they have dentures. They don't think and they need to remember one thing, Randy, that's very, very important, that when you don't have teeth or implants in your jawbone, it melts like soap in a soap dish. The bone loss is dramatic and it is for life. So that bone goes away. So there's a window of opportunity.
So earlier treatment is better.
Earlier is better. Earlier is cheaper. The treatment plan will never be more conservative, less invasive than it is right now.
Okay, good. And you have financing available. All of these photos are on the website?
They're on the website. A lot of additional information as well. And we invite people to call us. We'd be happy to have them come in for a no-fee consultation, no obligation. Gives them a chance to sniff around, get to know everybody.
All right, Arizona's first choice for dental implants. That's your goal.
That's correct.
All right.
Thank you.
I want to thank you for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, you can go to our website and just put a search in there for Dr. Gasser or dental implants. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.